Good afternoon. My name is Thelma Sardin, and I'm Marketing Manager at Gateway Foundation. We have a great discussion planned for you today. As you know, April is Alcohol Awareness Month, and throughout April, Gateway Foundation has shared facts and statistics on alcohol use and created an alcohol screening test. You can find this screening test via our Instagram page at Recovery Gateway, and the link is in the bio. Today, we recap Alcohol Awareness Month with a conversation between Jim Scarpace, Gateway Foundation Executive Director, and Bob Chapman, Program Director. Jim Scarpace has over 25 years of experience in the mental health, substance use disorder, and criminal justice field. Jim joined Gateway in 2007 as a Program Director, and he was promoted to Executive Director in 2013. Jim oversees Gateway Foundation's Aurora, Skokie, Downers Grove, and Joliet locations. Bob Chapman is Program Director at Gateway Foundation in Aurora. Bob has over 15 years of experience in the substance use disorder and mental health field. Welcome, gentlemen. We ask our viewers that are joining us today to send Bob and Jim questions via the chat function. Thank you, and I'll return later.
Thanks, Thelma.
Thank you, Thelma. Well, Bob, I'm excited to be able to talk to you about this. I know we work so closely together around this topic and around helping clients with alcohol use disorder, and have been for over a decade now together. And
right.
I think it's a great opportunity to not only let the audience know, but let family members know who may be having someone who struggles with an alcohol use disorder, some strategies and options on what to do, if they're, seeing someone they care about, struggling with alcohol.
Agreed, Jim. Thanks. I appreciate the opportunity to really talk about our program and talk about what we've done specific with alcohol at Aurora. We developed the Recovery Advantage program 2 years ago now. Managing COVID kind of changed our landscape for a little while, but we've been back in running the alcohol focused program for now the past 3 months or so.
Yeah. And, especially with alcohol use disorder, I think it's just so important to get the message out there that recovery is possible. And I think the Recovery Advantage program is a great example of really a specialized approach to treating alcohol use disorder, because it's such a widely accepted substance in our country that it can just be so misleading in terms of the risk factors associated with it. And, we see the stats that 40% of all inpatient hospital beds are related to alcohol use disorder or alcohol related issues, 88,000 deaths a year associated with this in terms of motor vehicle accidents. We know the stats that, 1 in 10 or maybe even 1 in 20 individuals could struggle with some level of alcohol use disorder in their lifetime, yet it tends to be a substance use disorder that's not as widely discussed or addressed in media. It tends to be downplayed as something that people should just be able to manage. And I think that's what makes it so hard for people to come forward and ask for help.
Right. We see a lot of that with the ambivalence of clients coming into the program, where families don't really realize that it is an issue, that it's impacting their family, their livelihood, their work, their community. The reason we moved towards that program, that specific program, we saw more than 65% of our clients identified alcohol as a primary substance. Alcohol recovery is challenging because so much of it is acceptable in society. As people walk out, they have immediate access at all times to alcohol. It becomes really challenging for our clients to kind of change the way they approach the world when they transition and prepare for some of those high-risk situations, because they are inevitably at family gatherings, at the stores. It's promoted at every sporting event. They're bombarded with promotions encouraging them to use their substance of choice.
Yeah, and you bring up great points there with all of those, components of where alcohol is promoted and advertised and accepted. I mean, unlike other substance use disorders that we help individuals with, opiate use disorder is a great example. Opiates and opiate use disorder, whether it be prescription pills or heroin, has been in the news. People recognize the dangers. We see the overdose stats associated with those, especially during this COVID pandemic, and the increase in those overdose stats, but we don't hear as much about alcohol use disorder. And if you're someone who struggles with an alcohol use disorder, it's one of the only substances where you're going to be around your family and others that you care about or are close to who are using that substance.
Right.
And you have to then figure out how to navigate those situations, because I always say in a lot of my trainings that perception is reality. And, the reality of this situation is it's really easy for people to perceive, hey, I can drink and be fine and walk away. I'm in that, 80% of the population that, can manage alcohol and doesn't have the genetic predisposition or the physiology that, will put me at risk for an alcohol use disorder. But if you're in that, 10 to 20% who might struggle with it, it's hard to say no. It's hard to just say, oh, I'm just not going to have a drink this time, or to tell someone I'm really having a hard time with being able to stop drinking on my own, because everywhere you look, it seems like it's promoted or encouraged.
Right. And it's interesting that you bring up the magnified lens on the opioid crisis, because we know that more people die from alcohol and alcohol-related diseases than all other substances combined. It's always been at the forefront of recovery and treatment, which is why we really try to curtail our program to target and prepare people to be successful in early recovery. We redesigned our curriculum to focus more on the physiological, psychological. Certainly, acute withdrawal from alcohol is significantly more dangerous than opiates or other substances. So, we see recovery as a vehicle, and the medical disease model that we use prepares people to be successful when they transition.
Yeah, and I think that, as you said, there are so many people that we see, even though we know this is such a bigger struggle than some people might believe in terms of the number of people who struggle with alcohol use disorder. And during this COVID pandemic, we've seen people coming in with that struggle, with that alcohol use disorder being more severe than ever, because they've been in isolation more, they've been emotionally disconnected and physically disconnected for good reason, from people or places that might identify or say, hey, we're worried about you, or hey, you're drinking more than usual, or, we're just concerned about, what's happening in your life. Yet the people who come and get treatment, we see people achieve and sustain recovery every day in our Recovery Advantage program as they discharge, and in all of our programs across the state, really, that Gateway offers. But it's really about getting people in that front door, because the sooner they can access treatment, the better chance they have of achieving recovery. And sometimes I think people don't understand what they should be looking for in terms of risk factors, signs, and symptoms. I'm hoping maybe you could, give some background on that based on what you've seen.
Well, sure. Some of the signs and symptoms, the early signs, we see people who continue to enjoy to drink longer than their family members or longer than their friends, potentially impacting work or school the next day, taking longer to respond or really engage in social activities sometimes, depending on where they're at with their relationship with alcohol. We see stressors in the family where family will start taking on responsibilities that their loved one might have once upon been proud to own. It might be the finances. It might be taking on an extra job. It really impacts family as much as the person struggling with the alcohol use disorder. Our program really focuses and and tries to pull family in. There's so much we can do. You know, as a client comes into us for 35 days, we see them change dramatically, very quickly, become that person that everybody once knew and loved, and we're excited to see. The challenge is now, how do we keep that momentum once they transition or once they complete the program? So we put a lot of safety nets in place to support that recovery. And a lot of it has to do with family or friends or close people in that network. We know that connectivity really promotes long-term recovery. And we know that alcohol use, substance use, drives isolation. So early onset is oftentimes maybe just a little overdoing it and some excuses, forgetting some things that might have happened, not having great recollection of some of the previous night, kind of joking about it. In fact, unfortunately, a lot of our sitcoms will poke fun at people who have lost track of time due to alcohol use. And really, though, that's a big red flag. That most people who start to feel intoxicated, who don't struggle with alcohol use, will start to feel uncomfortable. They'll start to feel anxious or a little out of control, where somebody who's enjoying or not necessarily enjoying, but struggling with substance use disorder, alcohol use disorder, will see that as the opportunity to really increase the use to create more of that euphoric experience.
Yeah, no, and you said a couple, I think, important things there. One is, one of the things that's important to us at Gateway is recovery support education, because we know clients who struggle with this have the best chance of staying in recovery if their loved ones and family members become experts in not only their illness, but in their recovery. And we know, and we've known since the 50s, that this is a physiological disorder. I mean, it affects the body. It's a psychological disorder. It affects the brain, and it's a social disorder. It really, breeds isolation when it's in full force. But it's a disease of the brain, and it can be treated. And I think that, one of the things that I found to be very beneficial about Gateway's programs is we have a holistic approach, and we really address all of those components, and we really do a lot of disease education around alcohol use disorder in that Recovery Advantage program to really help people understand that there's such a strong genetic predisposition to this illness, more so than even a lot of other substance use disorders, that you could be born with a history or heredity to be at risk to develop an alcohol use disorder. And it gets triggered by your first exposure or access to the substance, where you're drinking in high school, college, as a young adult, whether you should be or not. And your friends are able to walk away from it, and it has a greater pull on you, and you're not able to stop drinking. It really becomes a central focus of what you try to do and what you get involved in and who you hang out with. And it's a progressive illness, so it gets worse over time, not better. We know that as well. And so being able to get that word out there that, hey, if you're struggling with this, if you're hearing this and it's resonating with you, or if you're a family member who says, I know someone who is experiencing these types of struggles, reach out, get them help. If you're the person, reach out, because help is out there. And I've had so many clients say to me that, and you heard this too, Bob, I'm sure, from the clients at Gateway, that I wish someone would have said something to me sooner. I wish that someone would have called attention to this, because even if I would have been resistant, or even if I would have power struggled with them, that seed would have been planted. And maybe I would have gotten help sooner, because as this illness progresses, as you alluded to, the symptoms don't only affect the brain and behavior. It starts to affect our organs. It starts to affect medical related issues tied to stroke, cardiovascular disease, seizure disorders. We've seen too many people come into Gateway with later stage alcohol use disorders who are on transplant lists. Whether it be liver or kidney related issues. Right. But we really want, and it's an illness that you can't just handle on your own. I remember one of the clients we had at Gateway, got right up to the door of admissions and was talking to our admissions counselor and just said, I think I can handle this with just 12-step meetings. And and then came back through after 2 or 3 more DUIs and really got the treatment that she needed at that point, which I think was huge. And she's, been successful in the recovery process, but it's not something that that you can just will away. It's like any other medical condition. You have to follow the recommendations and get the treatment, but treatment works. And if you get into programs, if you get into Gateway, we can help people achieve that goal.
Absolutely. And I think, you bring up a great point. Some of the barriers really to this idea that I shouldn't have to do this alone, or I can do this alone, come from some of the stigmas that we've worked really hard to reduce. This idea that it's a choice, this idea that, like you said earlier, willpower can manage or initiate abstinence. Really, really challenging to do in a setting where that's where I do all my drinking, or that's where I do all my using. To be able to change that, and that's what one of the greatest assets that recovery treatment offers is, time and space between that last alcohol use and the potential for the next one, and with that time, allowing the mind and the body to really recover. I said earlier, we see in just 3, 4, 5, 7, or 10 days, 180-degree difference in 99% of our clients, where family will do a Zoom or come in for a family session, and they hardly recognize their loved one because they haven't seen them in that place in so long. The disease, alcohol, is unique in the fact that it impacts all of our body. When we talk about most other drugs that get into our bloodstream, get into the brain and initiate a mass dopamine release or serotonin, norepinephrine, neurotransmitters that create this euphoric state. Alcohol impacts every cell in our body, which is why it breaks our bodies down so quickly.
Yeah, and I think because of that, I know our tagline at Gateway is addiction medicine saving lives, and part of that reason for that tagline is to break down stigma.
Right.
To reinforce, like you said, this is a medical condition, and to treat it as such. And we have some great medication-assisted treatments right now for alcohol use disorder, as people are coming in at an early withdrawal from that substance, right, so that they can manage their cravings, so they can manage the physiological and psychological withdrawal from alcohol, so they're not at risk for seizures or other high-risk medical conditions, that we really start to then, as they start on those medications, look at co-occurring disorders like depression or anxiety or mood disorders that we know have such high correlations to alcohol use disorder that people struggle with both. So being able to treat those conditions as well in our Recovery Advantage program and get people not only on the right medications as needed for both mental health and substance use disorder issues, but also really start a series of evidence-based practices like DBT, like CBT, like mindfulness-based interventions, disease education, trauma responsive care, co-occurring disorder treatment and education, to really holistically treat this illness and all components of it. And I know that, next week when I do that webinar, we're going to be talking about alcohol use disorder and evidence-based practices. A lot of that's going to be included in there as a way to really look at and really start to do a deeper dive into some of the effective interventions that you've seen and been a part of, Bob, over the years that help people achieve recovery from this illness. Yeah. And I know that, in the next minute or so, we're going to open it up for questions from our viewers, but any closing thoughts, Bob, that you want to add that we didn't get to talk about?
Well, I'd just like to follow up on what you just kind of brought to fruition here. This idea that, our program is evidence-based and it's evolving. We are currently updating our curriculum to meet the needs of the client, and really our Recovery Advantage program. I asked the team before I came to talk with you today, I said, so what is one thing that the world should know about this program? And, there's a couple things that really stand out about what we've been able to do here. The client counselor ratio is small. It's 5 to 1 maximum, which is really very, very intimate therapeutic relationship that happens. One of the comments was, we have a real personal touch here. We build a small cohort that really becomes self-perpetuating in their recovery, where they really pull for each other, work through unique things that are specific to alcohol, and aren't distracted with, some of the other minutia that comes with some of the other substances. Not to discount, their experiences, but there's certainly strength in that unifying, or that common enemy, and alcohol for this group becomes that common enemy.
All right. Now, back to you here.
Well, great. Thank you. Thank you both for this great conversation. I think it's really important that we have these discussions, especially as we navigate the pandemic, and dealing with its effects. I have a question for you both. And I think you kind of alluded to it during your conversation, but have you all seen an increase in individuals coping with alcoholism due to COVID and the isolation, social isolation, I should say?
Yeah, absolutely. Absolutely.
And if you look, do you remember right when COVID started, what was running off the shelves? What was in short supply? It was alcohol and toilet paper.
Right. A strange combination.
I know, but yeah.
And unfortunately, because of that, the social isolation we all had to do as a country to manage this COVID pandemic, the implications for someone who's struggled with alcohol use disorder have been severe. And now that we're seeing people coming forward and asking for help after months or even a year of, that isolation, their disorder has progressed much more quickly than we've ever seen before.
Mm-hmm.
Absolutely.
Wow. Okay, well, we have a very special event next Thursday. Jim, Scarpace will be hosting a free webinar that will be available for 1 CE credit. The title of that webinar is The Treatment of Alcohol Use Disorder Utilizing Evidence-Based Practices. This 1-hour training will focus on understanding alcohol use disorder, AUD, from a biopsychosocial perspective and the types of evidence-based practices used in treating AUD. The webinar will also examine reducing barriers associated with stigma to improve access to treatment of AUD. So I think we should have it up now. Great. So if you want to sign up for this event, you can use your phone to scan the QR code in the top right-hand side of your screen, and it'll take you directly to the landing page where you can sign up for that free event. So please join us next Thursday. I want to close by thanking both of you for joining us today to talk about this very relevant topic. We really appreciate your expertise and your knowledge, so thank you very much. And to our audience, I want to say have a great afternoon and be well. Thank you so much. Bye.
Thank you.
Thank you, Thelma.